In this lecture series, we are going to talk about the ethical aspects of research. This series is primarily made for the MD Ayurveda first year students, referring to the syllabus of research methodology as prescribed by CCIM. The whole topic pertaining to the ethical aspect of research would be covered in 3 lectures, and this is the first lecture in this series. So in this lecture, what we are going to cover, the syllabus component of this particular topic as referred by CCIM is: number 1 is the ethical aspect related to the human and animal experimentation. Second is the information about Institutional Ethics Committee, that is IEC, and Animal Ethics Committee, that is AEC, and their functions. And thirdly, we are going to talk about procedures to obtain clearance from respective committees, including filling up of the consent forms and information sheets in publication ethics. The learning objective of this lecture is we would be realizing the meaning and purpose of ethics of research in general, and we would be finding that how it is going to be appropriately applied in Ayurvedic research. So we are going to begin the first part of this lecture series. Animal aspects related to human and animal experimentation. We know that research related to health and disease essentially involves human and animals in order to gain the knowledge by observing others from the similar background. This knowledge, what we are obtaining by observing others, may be related to various aspects of a disease process and its cure. Like, there are many aspects of this learning. Few of these aspects could be the cause of the disease. We can learn about the cause of the disease. We can learn about the clinical features, natural course of the disease, complications of the disease, and possible cures. Ethics in observation and interventional research. When an investigator do not wish to influence the outcomes by his intervention, this is observational study. If we need to define the observational study, the simple definition is: the investigator is merely observing the research without intervening in between and without having any intention to modify or influence the outcomes of the research. So this would be the observational research. So while doing the observational research, there are no big ethical issues. Large part of the history of medical research, including the development of Ayurveda, is composed of observational research, which did not really involve a lot of ethical issues because we are not willing to intervene in the ongoing situations. Ethical issues arises only when we interfere with the natural course of illness in presumption to mitigate the disease. We try to give some kind of interventions in order to think that these interventions are going to modify the disease outcome in some way. Ethical issues arise here in this situation because this presumption may not be always true. Many times we presume that this intervention is going to help our patient, but sometimes it happens that it may result in adverse outcomes also. So here the ethical issue arises. Interventional research, when we talk about interventional research, contrary to the observational research, this is a research where we are willingly giving some kind of intervention to the research participants in order to see that how they are going to modify the net outcome. So this interventional research involves a lot of ethical issues. So let us see how the ethical issues, how the concept of ethics in interventional research got developed. Ethics in the healthcare has a very, very long history. The first concept of ethics in the medical practice was given by Hippocrates when he launched the idea or concept of the first do no harm. This was the first ethical principle which was given by Hippocrates related to the medical practice. Historically, when the interventional researches were initiated in healthcare, it was done on the people with reduced autonomy. When we have started doing interventional research, it was quite obvious to think of that from where we are going to get the participant. So naturally, the participant where the people or where the persons who were having the reduced autonomy. What do we mean by reduced autonomy? By means of the reduced autonomy, we mean that these are the people who do not have a liberty to resist. If you are willing to give some kind of intervention to them, they do not have an autonomy to resist for that. They do not want to have this intervention. So it's like a person or animal living in cage who are the one who do not have a autonomy to reject the propositions given upon him. So this category of the people who belong to the reduced autonomy may be the war prisoners, slaves, subordinates, insane people, comatose people, and minors. And this also happens. This also happens with the animals which are there in the cage. So these people are often subjected to experiments known to cause harm. Sometimes it happens that when we initiated interventional research in the beginning of the history, we were knowing that these are the interventions which are going to cause harm, and these interventions have never been explained to the people about the outcomes, and the people have not been ensured about any care for any adversity which may occur because of the intervention. Let us look at the historical development of ethics in research. The first written document about the ethics in the research was given just after the World War in 1947. It is Nuremberg Code, and this proposed to safeguard the rights of World War prisoners being used as the subject of healthcare research. This also proposed that research may be allowed on human subject only if the results are expected to benefit society. The subjects have given their free and not forced consent, which may be withdrawn any time, and no harm to the subject is expected to result from the experiments. The second big development came in 1964 in the form of the Helsinki Declaration. This allowed the subjects of reduced autonomy, including children, to participate in research provided their consent is given by the responsible caregivers. In case of a pediatric subject, the consent was essentially required from the parents, and this declaration is continuously revised since it is initially formed in 1964, and recently it is revised in 2013. And finally, there was a Belmont Report, 1979. The National Commission for the Protection of Human Subjects in Biomedical and Behavioral Research published the Belmont Report, the Principles of Ethical Research on Human Subjects. And this report provided the conceptual foundation for a major revision of the US research regulations in 1981. Now let us look at the animals in research. Animal studies are required. Many times animal studies are required in the research for better understanding of physiological and pathological processes, for preclinical testing of new treatment modalities, eventually aiming at better health in humans. Such studies often involve drug toxicity studies where animals are exposed to higher doses of drugs to see their effect upon vital organs and systems of the body. And there are many ethical, scientific, and legal and economic reasons for making sure that animals used in research are cared properly, used in minimal numbers, and used only when it was highly desired. For ethical use of animal in science, there is a concept of 3 R's which is being used as the guiding principle. Let us see what these 3 R's. So the 3 R's for the animal use in research are primarily replace, reduce, and refine. Replace means methods that avoid or replace the use of animals in research should be employed. If the animal is not really essential to be utilized for that particular research, and if there can be certain alternatives, it is better to replace the animals from those alternatives. The examples are the in vitro studies, the in vivo studies, and cell line studies. The second R is reduction. It implies to the use of methods that enable researchers to obtain comparable level of information from fewer animals, or to obtain more information from the same bulk of the animals or same number of animals. And third R is about refinement. which says that we need to use the methods that alleviate or minimize potential pain, suffering, or distress and enhance animal welfare for the animals used. So this also looks at the animal rehabilitation wherever it is possible. Concerns about animal ethics. What are the concerns about the animal ethics? US Public Health Service published its Guide for the Human Care and Use of Laboratory Animals in 1963. This guide recommended research institutions to form institutional animal care and use committees, that is ISCUCs, to review and oversee animal experiments. And finally, the US Congress adopted the Animal Welfare Act in 1966, which protect animals used in research excluding rodents and birds. Various states adopt or revise animal cruelty law, which also protects animals used in research. This would be a great surprise to many of us that although US has adopted this Animal Welfare Act in 1966, India has adopted this act, this Prevention of Cruelty to Animal Acts in 1960 itself. This act defines the cruelty in terms of research as willfully and unreasonably administration of any injurious drug or injurious substance to any animal, or willful or an unreasonable attempt to cause any such drug or substance to be taken by any animal. This Prevention of Cruelty to Animals Act 1960 contains many chapters. Among these, the chapter 4 comprises about the experimentations of animals, and it talks in detail about the experiments on animals, committees for control and supervision of experiments on animals, and its subcommittee, and it talks about the staff of the committee, duties of the committee, and power of the committee to make rules relating to the experiments on animals, power of entry and inspection, power to prohibit experiments on animals, and penalties. So this is how we talked about the basic ethical concepts related to the animal and human research, or the research which is involving animal and human. In our next lecture in the series, we would be talking about the constitutions and role of institutional ethics committees and institutional animal ethics committees. Thank you.